Hi guys, Dr. Brad Mouroux, Spine Injury Medical Center, here to talk about joints and particular ligaments. Now, ligaments, kind of like this dark, heavy fibrous tissue of the spine here. What it does and what ligaments are, they're basically tight bands of fiber that actually restrict and govern motion of joints of the body. Now, they're kind of like the hinges of a door. So here we have the hinges of the door. What happens here, the hinges are like the ligament, and my arm and my body is kind of like the muscle. The hinges serve as the regulating motion of the joint. Ligaments can become damaged with repetitive trauma, of course, traumatic injury, and they can have different levels of injury. They can have strain, partial tears, or even full tears, and each one of those affects recovery. So whether or not you do simply rest, ice, and elevation, or if you need something more involved like injection therapy or surgery, all depends on the severity. Now, most times we are not having a full tear, and most of the time what we see in our clinic is unresolved old tears that never really got rehabilitated appropriately. And let's see what that looks like. Here we are with a patient's x-ray, and we see the curvature of the neck here. And one of the ways we find out is by using motion study. So what we are looking for is the backs of these vertebrae, and when this person looks up in extension, we see there's a big shift backwards in the vertebra. This shouldn't happen. The back of the vertebra here to the back of the vertebra here should be very, very similar, very, very close together. That's how we can see that there's ligament instability or ligament damage that is not resolved, been there a long time, and needs rehabilitation. One of the only ways you can really find it is through x-ray and using motion x-ray. A static shot like that wouldn't tell you. It's one of the things that we use to help figure out how to target therapy and how to help rehabilitate someone. Because most of the time, back pains and injuries that are chronic are a result of tears and injuries that went unchecked or unrehabilitated, and that's why we're still dealing with pain afterwards.